and good evening. My name is John Nako and today I'm going to demonstrate physical assessment. So the definition of this is an assessment, a physical assessment evaluation of the body and its function using EPPA examination of the body from head to toe. So the purpose of this one is to establish baseline to the client's functional abilities to supplement, confirm, and relate data obtained in the nursing history. To obtain data that will help establish nursing diagnosis and plan of care purposes of evaluate health problems. And the principle is before performing the physical assessment, always provide the patient's privacy, always explain their procedure, and last, wash your hands. So the equipments of this is we have the record book, the digital thermometer, and a pen and a Spiegel manometer. For those equipments for measuring the weight, the height, which is a tape measure, and that's all. So the first step is prepare all the necessary equipments and bring them to the examination area. Next step is prepare the area for examination. Make sure the doors are locked and the curtains are closed to provide patients privacy and to save time and energy. Next step is wash your hands to prevent microorganisms from spreading. And next, explain the procedure to the patient. Good evening, ma'am. I am John Nako, and today I'm going to have a general survey with you and to test your mental status. So the first step in the general survey is to observe the body weight, body build, height, weight, and in relation to the client's age, lifestyle, and health. Age is 51 and normal. Seems that your vary with lifestyle is normal. So the next step is observe the patient's posture, gaits, standing, sitting, and walking. Okay. Okay. Seems normal and relaxed. So the next step is observe the client's overall hygiene, groom, relate this one to the to the person's activity in prior to the assessment. Normal. Normal. Okay, it's normal. So the next step is note the patient's note the body odor in relation to the activity level. No body odor, seems normal. Then the next step is observe for the signs of distress or in posture or facial expression. No facial expression noted. Next step is note the obvious signs, health or illness. Wala kay gibati na sakit karon, ma'am?
Sakit lang ako ulo.
Okay. Headache. Check. Next step is assess the client's attitude. You okay ra, ma'am? Wala kay gikuan, ma'am?
Okay.
Okay. Check. And the next step is note the client's affect, mood, access, appropriateness of the client's response. So, ma'am, wala. How was your day, ma'am? Like, wala kay gikuan, ma'am? Okay ra magkakaroon, ma'am?
So far, okay raman.
Okay. Okay, check. Seems normal. Then the next step is listen to the quality, organization, quantity, listen to the quantity, quality, and organization of speech. So, ma'am, unsa gani imong trabaho karon, ma'am?
Akong work karon part-time clinical instructor,
Okay.
full-time housewife,
Okay.
and full-time mother of John and
Mm-hmm.
my four babies.
Okay. Norm. So the next step is listen to the quantity, listen for the relevant of an organization of speech. Listen to the relevant and organization of speech. Um, unsa man imong mga lingaw karon, ma'am?
Mananaw og Korean, mag-bake, magligo sa mga iro, o magdula sa mga dogs.
Okay, seems normal. The next step is assess the client's vital signs, for example, body temperature, blood pressure, and pain.
Ayun, sampo nga. Okay.
120/80, ma'am.
Iwa akong buto.
So, body temperature, your pulse, ma'am.
Kanina. Pikas.
One, two, four, 13, 14, 16, 17, 18, 19, 20, 21, 22, 23, 24, 70, ma'am. Seems normal. I think so. And kuan, ma'am, pwede ka maglingkod, ma'am. I mean, sorry, ma'am. Magigda, ma'am. Kaya akong i-check in yung respiration, ma'am. Put your hand here. Breathe lang, ma'am. Relax lang. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, ma'am. Seems normal. I think so. And kuan, ma'am, your pwede ka maglingkod, ma'am. 40 ang yung respiration mo, ma'am. Temperature is 37.6 degrees Celsius. The next step is calculate the body ideal weight, body mass, index waist, tip to ratio, mid-arm muscles, area circumference. 36. Okay, check. Next step is 40. The number 14 step is assess the client's cognitive abilities. Status exam. The mini mental exam may be used. So, ma'am, what is your name?
I am Mayet Nakua.
Can you tell me what are we doing today?
I'm using my cell phone now.
I mean, what are we doing in this situation?
You
today?
are interviewing me to get more of my datas.
Okay. Do you have any? Do you still remember what you did this day, ma'am?
I went to the market to buy ingredients for the tabirak
Okay.
and made some tabirak for the food of the king and prince in this house.
Okay. Okay. Can you still remember what did you do yesterday, ma'am?
Yesterday, the 4 dogs had their bath.
Okay.
That's
Okay.
it.
Okay. Can you recall where are we now, ma'am?
I am in the hospital bed.
Okay. So the final step is assess the client to empty his or her bladder and change it into a gown. Ask client to sit in examination table. So, ma'am, I'm going to give you a cup, ma'am, for you to defecate your
To urinate.
to urinate yourself.
OCR.
Then I will change you down into a gown. Into a gown, ma'am.
Here's my urine.
Okay, ma'am. Thank you, ma'am. And I'm going to change you, ma'am. So that's all.